It's now been 6 years since COVID-19 upended our daily lives, and while we continue to feel the aftershocks, March 11th was monumental. On this day in 2020, the World Health Organization declared COVID a global pandemic. The NBA suspended its season. President Trump announced a U.S. travel ban, and Tom Hanks tested positive for the virus. He is widely considered the first high-profile name to publicly announce a diagnosis. The virus swept across the globe, claiming an estimated 7 million lives. Social distancing and masks may have faded away, but COVID variants still circulate, and many people who haven't been infected in years are still dealing with symptoms. It's called long COVID. Fox 13's Evan Axelberg is in the newsroom with the impact some are still feeling. Evan.
Well, Haley, even 6 years later, some still get grim reports from their doctors. Almost everyone in America was infected by COVID, and for about 10% of those patients, more than 30 million people, the impacts are being felt in their everyday lives. Julie Talamo doesn't miss masks because sometimes she still needs one.
I'm a bit of a germaphobe now. I'm afraid to go in big crowds because I'm afraid of getting sick.
The Port Richey resident got COVID in 2022 and to this day has nodules in her lungs, experiences shortness of breath, and sees a doctor twice a year.
He walked in immediately and said, "Oh, well, this is your problem. You have asthma, you have chronic lung scarring. This is going to be your life. I can't do physical things I used to do."
Her case is among the approximately 30 million that became long COVID. More than 300 million Americans got COVID and 1.2 million died. Dr. John Morrison of Advent Health says he sees 2 to 3 long COVID patients a month. They mostly have fatigue, breathing and sleeping trouble, and headaches.
This particular virus is insidious in the fact that it just really revs up the immune response and it doesn't stop.
Most of the symptoms are treatable and are often made less severe if a patient was vaccinated for COVID before getting the virus. Dr. Michael Tang, a virologist at USF, says one lingering COVID effect is a positive one, and that is that knowledge of Myrna vaccines exploded, given they were developed to respond to COVID in real time, with cancer vaccines now a likely result.
We can think about having a personalized medicine approach for somebody's particular cancer, for example. How do we vaccinate against that particular cancer versus somebody else's cancer that looks similar?
When it comes to long COVID, doctors have learned that patients can get it even on a second or third infection. The lingering effects on the body and the mind are substantial. 6 years later, Jamie is reflecting on the damage it did to herself and to our society. COVID prevention measures, for example, became a huge topic of debate.
We lost friends. We lost family. We became even more divided than I think we already were.
Dr. Tang says USF has become the international headquarters of the Global Virus Network. A conference was just held at USF about pandemic preparedness and the lessons that COVID taught in response to the virus itself and also to its lingering effects. He says adaptability in developing vaccines and antivirals has been among the most important, particularly when it comes to real-time clinical trials. Haley.
Evan Axelberg reporting tonight. Evan, thank you.